Hey everybody, it's Megan Dooley here, creator of Mentorship with Megan, and I am coming at you today to talk about Chapter 3, Part 2, Intervention for your NBCOT exam. Again, I am following along with the National Occupational Therapy Review Guide book. If you haven't purchased it, I am just highly recommending this as a past faculty member, somebody who's taken the boards. I encourage you to seek that out as an option for preparation, but also hopefully these videos are helping you if you are more of an auditory or lecture type learner. So the previous section for Chapter 3 was on evaluation. This section is going to be on intervention and the key takeaways that you should have when preparing for your boards and reviewing this section. So this section focuses on intervention and everything that makes up your intervention, from the information you gather from your evaluation in preparing your goals and actually implementing that intervention with your clients. So the first thing that you want to study or review or just make sure that you recall from school is the different types of intervention and what they mean. So we have prevention, which is your primary. So we have primary, secondary, and tertiary intervention types. The primary prevention intervention would be the creation or promotion, or create or promote, and your health promotion. So this is looking at health and wellness and deterring the chance of somebody getting something. So this is just for the general population. You may be creating a wellness program for retirees. You may be creating a program for after-school kids to do some sort of physical exercise. That's what primary prevention interventions look like. So create and promote, that is a key word that comes from your practice framework. Secondary prevention is early detection of problems in at-risk populations. These are interventions looking at diabetic screenings, visual screens, all sorts of types of things that we identify a population, whether it's obesity or our ethnicity, and we are looking at providing interventions to decrease the chance of them getting that disease, whether it's diabetic education. A program that would fit perfectly with this would be my aunt, who was pre-diabetic. Her insurance covered her to be a part of a diabetic course and education to help hopefully eliminate her going into full diabetes and keeping her or decreasing her risk for developing full diabetic state. Tertiary prevention is the removal or reduction of dysfunction following an incident. So these are providing interventions to people. This is rehab. So somebody that's had a stroke, somebody that's had a traumatic brain injury, you're trying to reduce the dysfunction that they sustained in their ability to engage in occupations. So the accident has already occurred, and you're now looking at ways to promote them getting back to independence. This is much of that adult area, is that rehabilitation. The other important things are areas for intervention. Okay, so that was just prevention. Prevention, we have primary, secondary, and tertiary. So if we're looking at tertiary, we're going to remove or reduce the dysfunction following the incident and hopefully prevent any additional complications or secondary complications because of that incident. Example of that being somebody has had a spinal cord injury, they're in rehab, and you're educating them on pressure sores to remove the risk of a secondary infection or secondary complication. Okay, so primary, there is no problem as of yet. It would qualify for anybody in society, just the general population, but we're creating a healthy lifestyle or we're promoting health and wellness. Secondary is somebody has been deemed at risk, such as pre-diabetic, obesity, which may be looking at heart disease, individuals who have genetic components for Alzheimer's, let's say, or diabetes or heart disease, etc., and giving them education or providing them materials to hopefully reduce or detect areas of need to hopefully reduce their risk of that incident occurring or delay it. And then tertiary is that incident has occurred, whether they've had a stroke, they have diabetes, and have had an amputation. What can you do to assist them in getting back to being independent in their occupations and reduce the risk for further complication? So if they're diabetic and they've had an amputation, can you reduce the risk of a secondary amputation or another amputation or further complications from diabetic neuropathy, etc.? Another area of intervention is meeting health needs. Okay. Another area is the change process, achieve behavioral changes and functional outcomes. This is a key one, the change process, achieve behavioral changes and functional outcomes. This is one of the most often discussed and documented intervention types. The labels from your OT practice framework. Again, I've kind of encouraged you, along with this book and maybe some of your school material, to have that practice framework with you when you're reviewing, because a lot of what goes for the studying for the NBCOT aligns nicely with your framework. Words in the framework such as establish, restore, remediation, or restoration are going to fall under that change process, changing behaviors and meeting functional outcomes. So we're going to establish a home exercise program. We're going to restore function. Okay. Another area for intervention is management. And with this, from your practice framework, are such words as modify, compensate, and adaptation. So we are going to manage the dysfunctions by compensating for them to allow somebody to be as independent as possible. We're going to adapt their environment to allow the environment to match their abilities. Maintenance. Maintenance is a billable service. It is covered by Medicare and Medicaid as long as it is deemed medically necessary. So if you are going to perform a maintenance intervention, this is looking at preserving a current level of function for as long as possible. This works very well with individuals with Parkinson's disease, MS, ALS, any of those progressive diseases. And it allows you as the provider to train and educate and implement different strategies to help maintain that person's level of function. Once you've educated on those and the caregiver or the individual has demonstrated understanding, you cease that maintenance program until they may decline, and then you can come back in and do or continue that maintenance program. This has been a huge benefit because Medicare used to not cover or reimburse if you could not show improvements, which really left out many individuals with chronic diseases. So those are the main areas of intervention. Prevention, meeting health needs, whether it's in our community, in a nursing home, in a hospital. The change process, that is the most documented and talked about area of therapy or interventions. And this comes with establish, restore, remediate, and restoration. Management is a form of intervention, which is looking at modifying, compensating, or adapting. Then we have maintenance as our final intervention type, and this is maintaining current function for as long as possible. And this is very beneficial for individuals with chronic progressive diseases. When it comes to intervention planning, I encourage you to really make sure that you understand this area. If you struggle with any of these types of questions on the practice exams, make sure that you reach out and ask or find a study buddy. Intervention planning makes up 23% of your exam. 23% of the exam is based on the ability to track and understand that the intervention planning. What comes into intervention planning? All right, you do your evaluation, you choose your assessments. You're going to base your evaluation off of your frame of reference that you've picked. You get that data, and your frame of reference is going to be what guides your treatment of your interventions. Take that information, that theoretical basis, You're going to collaborate with the client, their family members, their caretakers, whomever it may be. You need to take into consideration your treatment setting. So if they're only going to be with you for 2 to 3 to 5 days, how much can you accomplish and what should be your overarching goal of that setting? And then you're going to prioritize the problem list. All of that needs to be taken into consideration. If you had a test question that asked you, what is the best practice for developing an intervention plan? And it says, develop your intervention plan based off of your frame of reference and the treatment setting. You are missing a big component of how you determine what interventions are best appropriate for that individual. So individualizing interventions or your treatment strategy is going to involve you collaborating with that family, but you also need to prioritize the problem list that meets your setting, but also meets the needs of that individual for them to discharge on to their next setting or discharge into the community. Your intervention plan has to have long-term goals, short-term goals, duration, for how long are you going to see this person, frequency, how many times are you going to see this person throughout that duration, number and types of interventions. Okay, so are your interventions going to be on prevention, maintenance, management, okay, or the change process? What is your intervention going to be based off of? This needs to be included in that intervention plan. You should include methods of interventions that you're going to use, such as occupation-based activities. Are you going to educate, train, or create a home program? Are you going to provide equipment? Are you going to create or produce orthotics for this individual? That all needs to be in that initial intervention plan or your evaluation report. So again, that seems as if, okay, yep, we've done this a lot through school. We're learning this in school right now. How do we determine what our evaluation plan is? But you need to make sure that you have this nailed down on all aspects across all populations, peds, adults, geriatrics, because this is 23% of your exam. Okay, this is not something that you can brush over. The only thing that may look a little different depending on the setting, if an individual is in acute care or someplace where the duration is very, very short, they may just have general goals or just a short-term goal to be met because they are not going to be in that facility or that situation for too long. But that is the only thing that may be different across settings. So once you've determined your intervention planning, okay, you've created your goal list, you've created the idea, you've discussed this in writing, what your focus is going to be based off of your problem list. You're now going to implement your intervention. I encourage you right now to pause the video and spend a little bit of time reviewing the table 3-3. It starts on page 43 and continues into page 44. It is a great table to help you understand occupations, their values, and how you can use them for interventions. And as we know, that is the main focus. As much as we can make things occupation-based, that is going to be our best intervention plan. I say that because should you read any test questions and there's 2 correct answers, whichever one includes an occupation and maybe the other one does not, always pick the occupation-based activity, especially when choosing out of 2 correct answers or that seem correct. If one is occupation-based and one is more of a functional activity or therapeutic activity, pick the occupation-based question or answer, okay? So go ahead and pause, review table 3-3, and then jump back on here to finish out this section. So if you finished up reviewing that, that's great. You have some really good ideas. There's some great examples that are listed in that table that help you conceptualize this information and how you should choose what interventions you're going to do. So there are different methods for review when implementing interventions, okay? First method, individual or group sessions. Are you going to do individual interventions or group? What makes you determine that? Very, very important that you review this. This would be table 3-4. You can review this now, but you need to make sure that you are aware of the foundational reasons for individual or group. Group should not be to get more clients seen at one time. A group exercise program may not be beneficial if the purpose of your group is not to develop interpersonal skills, engage in socialization, okay, motivation. If they are sitting there quietly doing a task like an exercise group and there's no motivation, there's no interaction, probably is not the best group intervention and should not be utilized. Okay, so make sure you review that table. And which one you would pick, individual or group. Then you can identify, are you going to use a purposeful activity or an occupation-based activity? Why are you choosing one over the other? But understand the purpose or the function of one or the other. One may be very appropriate to start off your session, a purposeful activity. It may also be very relevant when your client needs a little less of a giant task to complete, and having them do something purposeful that's preparing them for that occupation-based activity may be all that they can tolerate at that time to really hone in the skills and the deficit areas that are impacting their participation in that occupation. Another method of intervention is modifications and adaptations, going into someone's home and making environmental modifications, grab bars, giving or consulting on, you know, different structures for a shower, helping to modify their kitchen, making it easier for them to reach into cupboards, adapting the environment, changing the tone of a doorbell, changing some lighting. All of those things are a form of intervention. Another method of intervention is promotion of engagement for health and wellness. So promoting people to get out and participate in that exercise program, go to those educational classes, teaching them the strategies to really maintain their health and wellness. That's a great intervention. You can use an intervention that trains on adaptive equipment. Some people, that's what they do. They do AT assessments and treatments, and they train on all sorts of things from different uses for iPads to using a different type of a mouse, training on long-handled sponges and grabbers and reachers, all things that could be part of an intervention. PAMS, physical agent modalities, is another area of intervention, and this is something that you can use to prepare the individual to engage in a functional activity. Remember, we're not going to just do PAMS, physical agent modality. If it says the best option for this client is to have eSTEM to promote function with kitchen activities. No, okay? If there's an option in that question that says using eSTEM to allow or to improve or to encourage movement for the client to then go in and bake a cake or make a pie or whatever it may be, that would be your best intervention choice. And finally, ergonomics applied to participation in occupations. Ergonomics is a great area to work in. Going in and assessing somebody's computer space, workspace, even looking at ergonomics within the home or community is another form of intervention. Finally, the last area to really focus on when we're looking just at intervention development is developmental considerations for interventions. You really want to take into consideration when you're looking at children and that developmental ages, the cultural background, that you're bringing in interventions that are culturally relevant to the family, that are respectful to the family's culture. You need to make sure that all materials that you're using for your interventions are age-appropriate materials. Play should be your primary occupation intervention for those younger kiddos. Family education is going to be key in the developmental years because they all play a crucial role in guiding that little one in engaging in the taught techniques and strategies. Also, your ability during developmental years would be contracting with schools. That would be an intervention, training teachers, fabrication, or looking at positioning for kiddos, whether it is for school or just engagement in play activities or home activities. And also to develop or to promote, so interventions to promote sensory motor, cognitive development in those young minds. Okay, so those are the main areas of intervention. Again, I can't reiterate enough that when looking at intervention and looking at the actual intervention planning portion of this chapter, that makes up 23% of your exam. So you really need to hone in on, do you understand what assessments or that you use, do they align with the frame of reference that you are picking for your interventions? If you're reading questions that state really good intervention ideas, but the question provides you a frame of reference of rehab, or let's say it provides you the frame of reference or the model of NDT, and the main focuses of the questions, one relates to training on adaptive equipment, the use of adaptive equipment, and one talks about facilitation and inhibition of movement. Both would be great for somebody that's had a stroke, let's say, but you need to hone in on that NDT, that frame of reference of NDT does not align with the use of adaptive equipment. So although both answers would be correct, it would not match up with that frame of reference. That's just an example of things that, although the section seems like kind of duh, yes, we are on field work or you're doing a pro bono clinic or working a lot of PBL cases, you feel like you got a good grasp on the intervention planning portion and developing those goals and things. But be sure that you break this section down, review your frames of references, your models, and then how and what you are doing in different treatment settings that help you develop those long-term goals, short-term goals, duration, frequency, all of those types of things. If you have questions, please reach out below. There is a link where you can set up an opportunity to talk to me or get, some additional mentoring, or you can email me questions and see if, there's a need for a one-on-one meeting. But as always, I hope that studying is going well for you guys, or just preparing your material for that date when you begin studying. So I hope you all have a great day, and we'll chat with you later.